Okay, so for the cervical spine, we're going to use 3 landmarks to guide us to our joints. I will show you them prone, but you'll be palpating these joints supine. So the first landmark is on the occiput, the external occipital protuberance. We're looking for a noticeable kind of round bump. And from either side extends the superior nuchal line. When you go inferiorly, there's a bit of a dip, and inferiorly still, you'll reach another ridge, and this is the inferior nuchal line. The other landmark we'll use posteriorly is the spinous process of C2. So from the EOP, you can palpate down onto that planum nuchae, get to the inferior nuchal line, and then the next round bony prominence you'll feel is the SP of C2. So EOP, SP of C2. Keep up there. The last bony landmark we'll use to guide ourselves through the cervical spine is the transverse process of C1. So we're going to find the mastoid process behind the ear and the angle of the jaw, angle of the mandible. So to find that, you can just palpate along the jawline until you reach kind of the corner here. So from the angle of the mandible and the mastoid process, you can come in between and sink medially into the transverse process of C1, the atlas, which is tender. So first we'll palpate the median atlantoaxial joint. So the articulation between C1 and C2 medially. So we will find the transverse process of C1. So come to the mastoid process, find the angle of the jaw, angle of the mandible, sink medially. So you can palpate this bilaterally. And then with my other hand, I'm going to come posterior down from that inferior nuchal line to the spinous process of C2. And then I will move my finger that's on the transverse process of C1 medially towards the spinous process of C2. And then I'm going to come just superior to the spinous process of C2 to find that median atlantoaxial joint. With the head scooped up into my hands, I can do some passive rotation here, cervical rotation. For the lateral atlantoaxial joint, again, I'm finding the TVP of C1. So mastoid process, angle of the mandible, coming between and sinking medially until I find that TVP. Once I have this on the other side as well, I'm going to move just slightly inferior, scoop up the head again, and just a tiny bit of rotation. So C1, C2, that's our pivot joint. So rotation occurs here. For the last joint, the atlanto-occipital joint, I'm going to find the EOP, move inferiorly until I reach that inferior nuchal line. I'm going to keep one hand there, and with the other hand, again, find that TVP of C1. From the TVP, I'm going to move medially, not all the way to midline, but about halfway between the lateral aspect and midline. I'm going to match that hand on the other side. And the atlanto-occipital joint is just bobblehead movement, so a little bit of flexion, extension, and lateral flexion. So again, supporting the head, I will perform those movements on the body. Lateral flexion, flexion extension.